I want you to picture two futures. In one, at age 75, you need help with the simplest of tasks. In the other, you're still strong enough to play with your grandchildren. The difference between those two realities can be just 15 minutes a day, starting today. Here is a medical fact. After age 60, your body loses 3 to 8% of its muscle mass every single year. This isn't an abstract number. It's the reason why getting up from a chair becomes harder and why a flight of stairs can feel like a challenge. It increases the risk of falling, one of the single greatest threats to an older adult's independence, but this is something we can absolutely change. The solution isn't found in complicated exercises or expensive machines. It lies in 5 foundational movements, specifically designed to rebuild your functional strength. These exercises are simple enough to do while watching television, yet so effective they've been proven to reduce the risk of falling by up to 45%. Before we begin, ask yourself one question. Has a daily activity started to feel more difficult lately? Maybe it's carrying a bag of groceries or simply bending down to tie your shoes. If the answer is yes, then this video is for you. And if you're watching for a loved one, that shows a profound level of care. To make sure you don't miss these vital tips for your strength, mobility, and well-being, please hit subscribe and turn on notifications. Now let's begin. The first movement we'll discuss targets a part of your body that is absolutely critical for your energy and circulation, yet is often overlooked. I'm referring to your calf muscles. Medically, we sometimes call the calves the second heart, and this is for a very practical reason. Your heart does a magnificent job of pumping oxygenated blood throughout your body, but it fights a constant battle against gravity to get that blood back up from your feet and lower legs. This process is called venous return. As we age, the one-way valves in our veins can become less efficient, and without adequate help, blood can begin to pool in the lower extremities. This is what causes that heavy, tired feeling in your legs, as well as visible swelling or edema. Strong calf muscles act as a powerful pump. With each contraction, they squeeze the veins in your legs, propelling blood upward and giving your heart significant assistance. The exercise to strengthen them is the simple calf raise. To do it properly, stand behind a sturdy surface like a kitchen counter or the back of a heavy, stable chair. Place your hands on it lightly for balance, not to support your weight. Stand tall. As you breathe out, slowly rise onto the balls of your feet, feeling an intentional squeeze in your calves. Hold this peak contraction for 2 seconds. Then, and this is the most important part, breathe in as you slowly lower your heels back to the floor over a count of 3 to 4 seconds. This controlled lowering phase is what builds real strength and control. Aim for 10 to 15 repetitions, but remember, 5 perfect slow repetitions are far more valuable than 20 rushed ones. If standing for long periods is difficult, you can do this while seated. Sit upright in a chair with your feet flat on the floor and simply lift your heels, hold the squeeze, and lower them slowly. You are still activating that vital muscle pump. From circulation, we move to the absolute center of your power and stability, your gluteal muscles. Our modern sedentary lifestyle has led to a very common condition that physical therapists refer to as gluteal amnesia. Your glutes, which are the largest and potentially strongest muscles in your body, essentially forget how to activate properly because they are inactive for so many hours of the day. When this happens, other smaller, less capable muscles are forced to compensate, particularly the muscles of your lower back. This is a primary mechanical cause of chronic lower back pain. Your glutes are designed to extend your hips, stabilize your pelvis, and power you forward when you walk. When they don't do their job, your spine takes the strain. The glute bridge is the perfect exercise to reawaken these muscles. Lie on a comfortable but firm surface, such as a carpeted floor. Bend your knees and plant your feet flat, about hip width apart. Your feet should be close enough to your body that you can just graze your heels with your fingertips. Rest your arms by your sides. Before you begin the movement, gently brace your abdominal muscles. Then, as you exhale, press firmly through your heels and squeeze your glutes to lift your hips toward the ceiling. Your body should form a straight line from your shoulders to your knees. It is crucial that you do not arch your lower back to gain height. The work should come entirely from your glutes. Hold this bridge position for 3 to 5 seconds, keeping the glutes engaged. Then slowly lower your hips back down with control. If lifting your hips is too challenging at first, simply lie in the starting position and practice squeezing your glutes isometrically. Hold the contraction for 5 seconds, then relax. This will help re-establish the mind-muscle connection, which is the first step to rebuilding their strength. Now that we have addressed the foundational systems of circulation and lower body stability, we must turn our attention upward to our posture and upper body strength. One of the most common postural issues I see in my patients is what is often called a question mark posture, known clinically as thoracic kyphosis. This is the forward rounding of the upper back that pulls the shoulders forward and causes the head to jut out in front of the body. This is far more than a cosmetic concern. This posture is the result of a muscular imbalance. The muscles in your upper back, specifically the rhomboids and middle trapezius that are supposed to pull your shoulder blades together, become weak and lengthened. Meanwhile, the muscles in your chest become tight and short. This imbalance places immense strain on your neck and upper shoulders, as for every inch your head drifts forward, it adds about 10 pounds of effective weight for those muscles to support. This is a direct contributor to chronic tension headaches, neck pain, and even restricted breathing, as the collapsed posture limits your rib cage's ability to fully expand. To actively correct this, we need to strengthen those neglected upper back muscles. The exercise is called scapular retraction, which simply means squeezing your shoulder blades together. You can perform this while sitting tall in a firm chair or while standing. Raise your arms to your sides at shoulder height, then bend your elbows to 90 degrees with your palms facing forward. From this position, the key is to gently squeeze your shoulder blades together as if you were trying to pinch a pencil between them. It is critical that you do not shrug your shoulders up toward your ears. Instead, think of pulling your shoulder blades down and back, as if tucking them into your back pockets. Hold this contraction for 5 seconds while breathing normally. Do not hold your breath. Then, slowly release. You should feel a mild tension in the muscles between your shoulder blades, not in your neck. This is a perfect exercise to do several times throughout the day to reset your posture, especially if you spend time reading, on a computer, or driving. Next, we address a movement pattern that is absolutely essential for your independence, the ability to push yourself up. This brings us to the push-up, but I want you to immediately disregard the idea of military-style floor push-ups. We are focused on functional strength. The ability to push with your upper body is what allows you to get out of bed, to push open a heavy door, and most critically, to get up from the ground if you have a fall. The inability to get up from the floor is a major factor that can lead to serious complications and a loss of independent living. Therefore, we must train this movement safely and progressively. The ideal starting point is the wall push-up. Stand facing a clear wall, about an arm's length away. Place your palms flat on the wall, slightly wider than your shoulders, and at about chest height. Your body should form a straight, rigid line from your head to your heels. Do not let your hips sag or stick out. As you inhale, bend your elbows and slowly lower your chest toward the wall, maintaining that straight line. Then, as you exhale, press firmly through your palms to push yourself back to the starting position. The entire movement must be controlled. When you can comfortably perform 15 of these, you can progress to an inclined surface, like a sturdy kitchen counter or the back of a secured sofa. The lower the surface, the more of your body weight you are pushing, and the more challenging it becomes. If you ever feel pain in your wrists, Try performing the push-up on your knuckles with your fists closed, or use push-up handles to keep your wrists in a neutral position. This exercise builds strength in your chest, shoulders, and arms, but more importantly, it builds your confidence and your ability to handle yourself in the physical world. We have now established exercises for circulation, lower body stability, posture, and upper body pushing strength. The final piece of this functional puzzle is mobility, specifically rotational mobility of your spine. So much of what we do in daily life involves twisting. Looking over your shoulder while driving, reaching for something on the passenger seat, or turning to greet someone. Your spine is designed for this, but primarily in the thoracic region, your mid and upper back. Your lower back, or lumbar spine, is built for stability and has very little rotational capacity. When our thoracic spine becomes stiff from lack of use and we need to twist, the body forces that rotation to come from the more vulnerable areas, the lower back or the neck. This is a common mechanism for injury, leading to disc issues and chronic pain. Therefore, maintaining gentle spinal rotation is not just about flexibility. It's about injury prevention. A safe and effective way to practice this is the seated spinal twist. Sit tall in a sturdy chair with both feet flat on the floor, hip width apart. It's important to keep your pelvis stable. Place your left hand on the outside of your right knee and your right hand on the chair behind you for light support. First, take a deep breath in, and as you do, elongate your spine, sitting as tall as possible. Then, as you exhale, gently guide yourself into a twist to the right. Allow your gaze to follow, looking over your right shoulder. The twist should originate from your mid-back, not by cranking your neck or forcing with your arms. This should be a gentle, controlled stretch, never a sharp pain. Hold the position for 15 to 20 seconds and continue to breathe smoothly. With each exhale, you might feel the muscles relax just a bit more. To release, slowly return to the center on an inhale. Then repeat on the other side. This movement helps to hydrate the spinal discs and keeps the neural pathways for this motion active and healthy. Now that you have these 5 foundational exercises, the most important element is consistency. Performing them 4 to 5 times per week is the key to seeing real, lasting benefits. You can approach this in a way that best fits your lifestyle. You might prefer a structured routine, setting aside 15 minutes each morning to perform 2 sets of each exercise. This creates a dedicated and intentional time for your health. Alternatively, you may find a scattered approach more sustainable. This involves integrating the movements throughout your day. Perform calf raises while waiting for your coffee to brew. Do scapular retractions during a television commercial. Do a few seated twists after you finish a meal. This concept of exercise snacking is highly effective because it removes the barrier of needing to find a large block of time. The method you choose is less important than the commitment to consistency. Listen to your body, distinguishing between the feeling of muscle fatigue, which is productive, and sharp joint pain, which is a signal to stop. Track your progress not by the number of repetitions you can do, but by how you feel in your daily life. Is it easier to get out of the car? Do you feel more confident walking on uneven ground? These are the true markers of success. Each repetition is an investment in your own independence and quality of life. Start with just one of these exercises today. Be consistent. Your future self will thank you.